The pelvic floor is a group of muscles that attach to your pubic bone in the front. They wrap around the urethra, they wrap around the vagina if you have one, they support the prostate if you have one, they wrap around the rectum and attach to the coccyx in the back, and then they fan out to the sides to attach to the hips on both the right and left sides. The function of the pelvic floor is to keep all of those pelvic organs nice and tightly upped in there, but it also helps you to allow your bladder to empty. It supports the bladder so that you're not leaking all over the place when your bladder is filling. For the male pelvic floor, I tend to see my male patients have more of a tight or an overactive pelvic floor, meaning that their pelvic floor muscles are shortened. When we think about shortening, think about your bicep. When you do a bicep curl, those muscles in that area are going to shorten. So we have to learn how to lengthen that. One of the best ways that we can do to lengthen it is through some stretching exercises. So doing deep squats, doing butterfly stretches, hamstring stretches can be one of those really good ways in order for it to lengthen and to stretch those pelvic floor muscles for the male. So we just talked about most of the time males have an overactive floor. However, there are several situations where a male individual may have a more weaker pelvic floor. If they are having chronic constipation, if they've had a pelvic surgery or an abdominal surgery, say they've had surgery on their prostate, especially for prostate cancers where maybe the prostate was removed, all of that can actually cause some weakening of those pelvic floor muscles. So just like we talked about on females, you can do some strengthening exercises as well. So the same principle, think about if you were in an elevator and you were trying to pass gas and you're trying to hold that back, right? You squeeze those pelvic floor muscles, not your butt cheeks, but you squeeze those pelvic floor muscles. So that's one of the ways that we can strengthen those and then again, isolate those muscles so we can identify appropriately what those muscles are to strengthen. When we think about protecting the pelvic floor on a male perspective, there are lots of activities that men may engage in, like biking, right? We see a lot of road biking, mountain biking, and what's happening is it's putting a lot of pressure to that pelvic floor. Guys tell me all of the time, oh, I've got this really great seat, or there's extra cushions in there, but that's not always the case, right? There's still direct pressure that's going to that pelvis. And typically it's going into what we call those ischial tuberosities or those sits bones. That is all connected to your pelvic floor. When you do that, it creates this direct impact, and so those muscles get tighter and can even impact the nerves to that area also. So you may have loss of sensation, you don't maybe know when you have to go to the bathroom, and again can affect that constipation and defecating as well. When we start thinking about different occupations that can affect the pelvic floor, my truck drivers, right? They are sitting for prolonged periods of time. As much as we want to say there is that awesome seat and it has a cushion and those bouncy springs in it, there's still a lot of direct pressure, just like on the biking aspect, that can cause overactivity and even nerve damage to those pelvic floor muscles. We have seen lots of people now starting to work more at home, which means that they are sitting for prolonged periods of time, and so those seats and cushions still are not as supportive of what they could be for those pelvic floor muscles. So I encourage my men that are in those types of occupations to get up, walk around. If it's going on the hour, get up, move around, do some stretches while you're there so that you can make sure that you are always protecting your pelvic floor, keeping it functioning like it needs to, and not having overactivity as well.